Here's the continuation you've been waiting for. Our healthcare system is more dedicated to finding ways to bill people. Yeah, seriously. And that's pretty useless. It discourages people from going to the hospital because if you go to a doctor, you might just get some random bill of $5,000 or even $10,000. Yippee. That's where America is doing totally wrong in this stage of global pandemic. I mean, it's quite outlandish when you explain it to somebody who's not in the American healthcare system. It's pretty bad. More than 27 million Americans don't have health insurance, and many more don't have enough insurance. Meaning that a lot of Americans might put off going to the doctor if they start showing symptoms because it would be too expensive, and that is a major risk. The United States has only 2.8 hospital beds per 1,000 people, according to data from the Organization for Economic Cooperation and Development. That's even less than the 3.2 hospital beds per 1,000 people in Italy, where the COVID-19 outbreak has been particularly devastating. In China, the figure is 4.3 beds per 1,000 people, and South Korea has a whopping 12.3 beds for every 1,000 people. After the coronavirus outbreak in Wuhan, a new hospital with 1,000 beds was built in less than 2 weeks. It would be nearly impossible to duplicate that feat in America due to Trump's policies. It has been seen that a delayed diagnosis gives the virus more time to spread, and that could be catastrophic. What you need in a pandemic is really good surveillance of what's happening, and if people are afraid of the healthcare system, which most people in America kind of are, things are not going to go in the right direction. So CDC has warned that if there's an outbreak, Americans should expect disruptions to their daily lives. Gee golly guys, what's that gonna look like? You're gonna see a whole lot of supply shortage, everything from electronics to medication to parts for industrial inputs. From big box warehouses to neighborhood drugstores, Americans are preparing for a pandemic. We have to be concerned that people are losing their marbles over here. People are turning to savages, fighting over toilet paper. Yeah, guys, you can live without toilet paper. Awareness of the danger of the virus is fine, but panic just causes more chaos. People are stocking up on some of the medications. Officials say that risk of coronavirus infection is still low, but because little information is out there, we don't exactly know how many people are infected or just how dangerous the virus is. So panic is spreading everywhere. Are we nearing the stage of people being really panicked about a pandemic? In fact, I'm pretty sure we already are. While being concerned and slightly paranoid is fine, total uncontrolled panic is unhealthy. While a pandemic isn't a new thing, most people have never had one step into the streets of their own home. Either moderate or severe, the most important thing to remember is containing a pandemic is all about taking some crucial steps to control the vast spreading of the disease. The biggest factor of the coronavirus right now is novelty. That's why it's called the novel coronavirus. We don't see information about the flu in the news all the time. So in this situation, we're being reminded that there's this potential threat out there, waiting to beat up our lungs and respiratory system. Medical research shows that new threats, particularly diseases, usually raise anxiety levels higher than more familiar ones in the brain. The specific section of the brain, the one that's believed to detect and process fear. And studies show an increased response when participants look at pictures of potentially threatening things like unfamiliar viruses. It also has to do something with psychologists call risk perception. Research shows emotion impacts risk perception. Negative emotions like anger and fear can make you perceive higher risk. Then there's the anxiety for people who just can't afford to have something like a virus interrupt their lives. This affects individuals who don't have as much flexibility and resources in their daily lives. So for somebody who can work while locked out in a quarantine situation, might feel somewhat annoyed for these individuals who, to earn money, have to physically be in the location where they work, and that's pretty damn stressful. There are two things Americans can do right now to cut down on coronavirus-related anxiety. And that should be done in the right way, not the wrong way, the way that we've been doing for the past 3 months. First, mentally prepare for what disruptions in your daily life would mean for you. You do that at your own pace, your own way, best way to cope for you, without having to disrupt other people's lives. If your city locks down like we've seen in other places, don't panic and don't fight for toilet paper, crying out loud. Let's learn from the mistakes, from all kinds of levels, from the social level to the national level. Thank you for reaching the end of the video. If you have any comments about what you feel, please do leave your thoughts. And if we missed anything important, do write that down as well. Don't forget to like, share, and subscribe. And as always, stay safe and see you in the next video.